We begin again with breaking news. Help may soon be on the way for an American economy sent reeling by the coronavirus. The White House and the Senate have agreed to a roughly $2 trillion rescue package. That's 12 zeros for those of you who are counting. That's the largest in American history.
This comes as the number of coronavirus cases reported in the U.S. tops 55,000. More than 800 people have died. Nancy Cordes is on Capitol Hill for us, where stimulus negotiations went past midnight, but there was a breakthrough. Nancy, good morning. So what's next, and when will this financial help reach actual everyday Americans?
Well, as quickly, Tony, as the government can get all this money out the door, the Treasury Secretary says that some of these cash payments, $1,200 rather, for individuals, $3,000 for many families, can be direct deposited. But first, Congress has to vote. The Senate plans to do that later today, and it's expected to pass overwhelmingly.
The Senate has reached a bipartisan agreement on a historic relief package for this pandemic.
It was the early morning announcement the entire economy had been waiting for.
To all Americans, I say, help is on the way, big help and quick help.
The massive bill is designed to bring relief to workers and businesses, hospitals and state governments, and those who have already lost their jobs, boosting unemployment insurance by $600 a week through July.
It's crazy, but we'll be fine.
That money will help the 40 restaurant workers that Lisa Spooner and Kevin Clark, restaurateurs in Atlanta, were forced to lay off last week.
We're in a great country. There's money. We'll just go further in debt. I mean, people need help, and money is the answer.
To help other small businesses keep their workers on, the bill contains nearly $400 billion in grants, plus another $500 billion in loans for major industries like the airlines. There's also more than $130 billion for the nation's healthcare providers.
There is much more money for our hospitals, for our nurses and physicians, for our nursing homes, for our community health centers to do the job they need to do.
And $1,200 for most individuals.
We're going to pass this legislation later today.
Things have been moving so quickly that many senators will not have a chance to read the entire bill before they vote on it. They're just going to have to trust the negotiators. And then once it passes in the Senate, it has to go to the House, where they're hoping to pass it by something called unanimous consent, which would enable them to do it without bringing all the House members back to Washington, D.C. But, Tony, it would require every House member to agree to that.
Well, let's hope they can find some agreement. Every second counts in this, Nancy. Thank you very much.